Good morning, folks. It's Sonia from 2x2 Lagoto and 2x2 Kennels. Hope you all are doing well this morning. I'm coming to you from, guess where? Horse lessons. I'm going to talk today about vaccines and our vaccine protocol and why we vaccinate and what we're vaccinating against and what we choose or opt not to vaccinate against and what we recommend not vaccinating against. So the first thing is, let's talk about our vaccination protocol and why we choose it. We live in the South, and I opt for a more gentle vaccination approach. We do not start vaccinating puppies until they're 7 weeks old. The reason for this is that maternal antibodies are present in puppies until about 5.5 to 6 weeks of age in healthy mothers who have had their boosters or titers to make sure that they have an adequate response, meaning they would produce an adequate response to a particular disease, an adequate antibody response. And for all of our adults, they get vaccinated until they are 2 years old. So they do their puppy series. At a year old, they get boosted. At 2 years old, they get boosted. At 3 years old and on, we do titers on everyone. Yes, it's expensive. It is really expensive. But I believe that over-vaccinating our pets is causing autoimmune issues. It's causing liver and kidney failure. It's causing skin issues. And I'm not just saying this, there's clinical evidentiary information and research out there about this. So then we have puppies out of a particular mom. Let's just use this as an example. She had her puppy vaccines. She had her vaccines at 1 year old and 2 years old, and then she has a litter of puppies. So those puppies will have maternal antibodies until they're 5.5 or 6 weeks of age. Giving any vaccines prior to that is really just like, I might as well just throw that vaccine in the trash or spill it onto the ground because it has no efficacy. It is not effective at all because it cannot override maternal antibodies. So we wait until 7 weeks of age, and reputable breeders will take their litters to the vet to have these vaccines given. That is so that they have the full benefit of the vaccine warranty and guarantee for those vaccines that are given to those puppies. I'll explain later why that's important. So at 7 weeks and 10 weeks, 13 weeks, and sometimes 16 weeks, depending on your veterinarian, they will get the same vaccination, and that is called a DAPPV, distemper, adenovirus, parainfluenza, and parvovirus vaccination. And I'll break those four things down. The distemper is it's a respiratory virus, causes respiratory complications. It can cause some neurological symptoms, even to seizures. There's a dry cough with a discharge from the eyes and nose. There can be pustules or pus-filled blisters on the abdomen. There can be vomiting and diarrhea. Sounds like a lot of things that can happen. This can't be cured. We can give, or the veterinarian who's treating this can give antibiotics for this in the hopes that it will stem any secondary bacterial infections. But really it's just a matter of supporting a puppy who or an adult who has contracted this and hoping that they survive. Not terribly good chances of survival. Veterinarians haven't seen a lot of distemper in years and years. So the next thing is the parainfluenza virus, influenza, canine flu. It's a type of canine flu. There are multiple types of canine flus, multiple strains that are contracted differently. This particular one, parainfluenza, as you can imagine, has respiratory complications up to and including death. Parvovirus is a nasty virus. It is spread dog to dog like the parainfluenza and distemper, and it can survive in the environment for months and years. It can be dormant in the soil, in parks, in the grass, in your backyard, in the neighborhood. And I'm not trying to scare you, but I am just trying to tell you this is why I emphasize that your puppy doesn't need to be out wandering places, doesn't need to go to the dog park, doesn't need to go to places where unvaccinated or potentially unvaccinated dogs are frequenting. Only needs to visit with dogs whose vaccination and immune system status you know well until your puppy is fully vaccinated at 16 weeks. That doesn't mean you have to keep them in the house 24/7. Of course you can take your puppy for a walk. Of course you can take your puppy to puppy class if that trainer says that's okay. Anyway, back to parvovirus. It's about 80% fatal. It is transmitted dog to dog. There's the things with this that are typical: high fever, bloody diarrhea, vomiting, and what puppies generally die from is rapid, persistent, severe dehydration. If your puppy survives, if it contracts this, it will be a lifetime immunity. No more vaccinations required for parvovirus. None of these diseases that I'm talking about, bless God, we haven't had. We did have one puppy a few months ago who visited the vet at its 72-hour visit. After going home, the vet had parvo in the clinic over the weekend or the prior week, and even with 2 vaccines on board prior to leaving, the puppy did develop parvo. It did survive. It had a very mild case, which we're still investigating, but this is also why I preach, I jump up and down about this. Do not take your young puppy to a veterinarian who sees a lot of parvo. It is difficult to kill. It is hard to remove from the environment. And I don't care what the veterinarian says about their protocol for cleanliness, etc. Why take that risk? Find a veterinarian who just doesn't see it. That's my answer to that. I know it's inconvenient, but with an 80% mortality rate, I just think it's a precaution that needs to be followed. All right, so we've talked about distemper, we've talked about parainfluenza, we've talked about parvo. Oh, adenovirus. That's actually the second thing we should have talked about. But anyway, it's an upper respiratory disease. Don't see a lot of it. It can cause hepatitis. And sometimes, moving on to some other vaccines, sometimes veterinarians will want to give Leptospirosis is a waterborne bacterial infection. It is found frequently in environments that are muddy, mucky, marshy, stagnant creeks that are frequented by wildlife. It is spread through the urine of infected wildlife. There are sections of the country that do see this. My caveat to this is, if your puppy's immune system has had a chance to mature into young adulthood, and they are parasite free and have a great nutritional status, you really shouldn't have any problems. Over-vaccinating can cause a weakened immune system. Parasites can cause a weakened immune system, and poor nutritional status can cause a weakened immune system. Unless you think that feeding an $80 a bag dog food that is human grade and few ingredients and grain free will be proper nutrition, you need to watch my nutrition video, my dog food rant, because I have friends who have sick dogs because they are feeding these high-end dog foods, these boutique dog foods that are causing cardiac issues, autoimmune issues, liver issues, kidney issues. It's a thing, and these foods have been on the market, they haven't been on the market long enough for us to see long-term effects until really recently. And in my dog food rant, you'll hear me talk about, why this is a bad thing. It's not my opinion, it's clinical research. Tufts University has just had a massive research project come out about this, so it's not just something, hey, Sonia thinks. It's a clinically researched fact. Stop with the grain-free diets. Stop with the boutique foods. I know you feel like you're doing your dog a favor, but with this knowledge that's coming out, we're not doing them a favor. And anthropomorphizing a nutritional decision, it's causing problems. I digress. Anyway, back to lepto. Leptospirosis is a vaccine that historically has caused a lot of vaccine reactions. They can be local with some swelling and redness, all the way to it causes a huge necrotic area that blisters and has to slough off. It can cause autoimmune issues. It can cause lethargy, seizures, death. And we suggest, if you have to give lepto, if your vet just won't take another step without your puppy or dog having had lepto, meaning they're seeing it in their clinic on a frequent basis, and frequent, I mean, multiple times a year. I don't mean once in the last 3 years or every once in a while. I mean frequently. Then make sure that you are giving this vaccine on a separate day, because if you give this vaccine with or as a part of a 5-way vaccine, so distemper, adenovirus, parainfluenza, parvovirus, lepto, 5 different vaccines in one shot. If you're doing that and your puppy has a reaction or your adult dog has a reaction, guess what? They can't get vaccinated for any of those things again, because there's no guarantee that it wasn't something else. So separate it out on a different day, even several days apart, so you have a clear indication if there is a reaction. You'll know exactly what they are reacting to. And if you sense that there's been any kind of vaccine reaction, you need to get to your vet or emergency clinic immediately, so that they can administer medications to help with that reaction. It's an allergic reaction, and we've had several Lagotto puppies that have reacted. Clients have gone home and followed veterinary instruction and gotten the vaccines, and thank God they were given on a separate day, but they did have reactions. Last vaccine I'll talk about is rabies. Your rabies vaccines, depending on your state, are given anywhere between 13 and 24 weeks. It depends on our circumstances. If we're board to training, our board to train puppies get it before they're 16 weeks. Otherwise, it's between 16 and 20 weeks. And then they get a booster at 1 year. At 2 years of age, here in our kennel, we give a 3-year vaccine for rabies. So they're getting a vaccine every 3 years for rabies. Some states that's not legal. Just an FYI, the vaccine that's given at 1 year is the exact same vial, the exact same vaccination that is given for a 3-year. I figured this out a few years ago and nobody was trying to hide this. I just didn't know. I saw my vet tech at my vet clinic, or the vet tech at my vet clinic, pull out the tray to vaccinate several that had come in, and she accidentally checked 1 year on my chart, and I said, no, these are all getting 3-year. And she said, oh, okay. She crossed that out, put her initials, checked 3-year. And I said, don't you have to get the 3-year vaccine out? And she said, oh, it's the same vaccine. I verified this with the vet, verified it a couple of other places. So there you go. If we did titers on our animals, we would see that the vaccine at 1 year, sometimes even at 2nd year, gives lifetime immunity. So be very careful. If it is allowable in your state to do a 3-year vaccine instead of a 1 year for rabies, please opt for that. And I do, and I am a huge proponent of holistic veterinarians who practice titers and practice not over-vaccinating. It is something that especially your old-time vets aren't keen to. I would love to follow Dr. Jean Dodd's veterinary vaccine protocol. She doesn't start vaccinations until sometime in the 12 to 16 week range. And living in the South, I wish I could, I just can't. So to wrap things up, for our vaccinations, we give a 7-week, 10-week, 13-week. For us, that's it. Some veterinarians recommend a 16-week. I will leave that up to you. All our puppies leave here with veterinary records that are certified. It's not something I just wrote down and pulled out of the air. It's actual certifiable, verifiable vaccines that were given at 7, 10, 13 weeks. And then we booster at 1 year and booster at 2 years. And at 3 years, we are checking titers. Every year to 3 years, we check titers. It just depends on, my show dogs that are out all the time. They're getting titers every year. Mama dogs are getting titered every year. And we booster a lot more with our mama dogs because it's critical that they're able to pass on immunity to puppies. Those maternal antibodies are critical for those first 5.5 to 6 weeks. So I think that's it for vaccine. My vaccination thoughts. Oh, the Bordetella. I didn't talk about Bordetella, and I didn't talk about canine flu. Oh, glad I remembered that. Bordetella is also called kennel cough. It's a dry, hacky cough. Dogs do well with treatment. I haven't heard of dogs dying from it in recent years. In fact, I don't think I've ever heard of a dog dying from it. I don't think I've can recall, and I don't think I have any friends who've lost dogs to Bordetella, but your groomer, your trainer, any place you board may require Bordetella. They're really just covering themselves. Stress can lower immune systems, so mitigating stress, making sure that you don't coddle your puppy, your adult dog, that creates stress. Making sure that you have continued on with proper socialization and training. A well-trained, well-socialized, not coddled dog has a great response to stress. They just don't get stressed. They're bomb-proof. We send our puppies off as bomb-proof puppies and hope that you'll continue what we've done, our puppy culture stuff, our training, our socialization. So we don't give Bordetella, but you may be required to give it, and if so, it's just one of those things. You'll be fine. The reason I said, as I mentioned, my vet doesn't give it is because he hasn't found it terribly effective, meaning he was giving it to dogs and dogs were still getting Bordetella. So why give something? Why engage the immune system, create an overreactive response in the immune system for something that is going to be ineffective? Because the virus mutates, and anyway, that's his philosophy. Same with the canine flu. The canine flu is a rapidly mutating virus. It can cause death. Very, very sick dogs. I have friends who had very, very sick dogs last summer when this went through all of the dog shows. Again, mitigating stress, maintaining a proper nutritional status, parasite-free, you're using your Interceptor Plus every month, will go a long, long way in making sure that you don't expose, or if your dog is exposed, they can fight it off. We don't suggest vaccinating against the canine flu for the same reasons. The virus mutates too fast, kind of like with the human flu virus. In fact, sometimes it's given dogs as it has given humans the flu. So if you have any questions about anything I've talked about today or any of my other videos or about our program or our puppies, please reach out to me. You can do so by email 2x2lagoto@comcast.net, our website 2x2lagoto.com, or give me a shout through Messenger, Facebook Messenger. We're on Facebook, 2x2lagoto. Hope you have a great day and hope you learned a lot. Thanks.